Hi, everyone. Dr. Paul here from the Center Health Unit with another COVID update. Today is October 5th, 2022. And as usual, I'm going to start with our local statistics. Our numbers have been stable with a slight downward turn. So we can see basically that we're a bit less hospitalizations than we were last week. We still have 2 in the ICU, but the graphs will show it a bit better here. So you can see that, again, we had a bit of a peak of admissions over the last couple of weeks and then downwards, downward trend. And again, we're seeing the same provincially. It's kind of hovering at a sort of a minimal moderate level in terms of hospitalizations, both locally and provincially. If we're looking at our institutional outbreaks, again, you can see that we had a bit of an uptick last week and then down again to 14, but still, you're seeing sort of a relatively flat, here and there, up and down, and that's again what we're seeing across the province. Again, just to stress that this is what's really driving. Again, we have almost 200 people here, actually 181 now, of the cases that we have are driven in by these outbreaks, most of which, like I said, the residents are fortunately not very sick, and a lot of them are asymptomatic. In terms of our percent positivity, that too is having a downward turn. You can see now we're going down we're about 10% right now, and so that's a good sign for us in our area. And again, these peaks are all reflected by when we go in and test long-term care homes, for example. Very often, for example, in one home we had at least 30 or 40 people that were positive out of maybe 100. And so that was a high positivity rate. And so that's what's driving a lot of the positivity as we look back exactly to see what's going on. And again, and when we're looking at sort of a community-wide level, we're seeing a very flat wastewater number here, which again shows us very flat in Cornwall, quite flat here in Hawkesbury, a downward trend and a lower trend, obviously, in the Castleman, and the downward trend again in Morrisburg. So, this just reflects to me that the cases that we're seeing are really, very, very concentrated along the outbreaks, the outbreak in the long-term care and retirement homes as well. In terms of our, if we're going to look at sort of provincially where we are, this is the new Public Health Ontario sort of daily update of where cases are. And you can see this is the EOHU Health Unit one. I've done it from really all the way from last year, so you can kind of see from 2021, and this is this year. This was in April. This is our January peak, as you saw. We had a lot of cases, and then downward trend, and then this was the July peak, and then you can see we had a bit of a September peak, which I think reflects people going back to work, indoors, back to school, and so on. And then you can see a downward tick here as well. Again, these are reflected more by what we see in the outbreaks, but again, overall, the community numbers are in a downturn. If we look at other things as well, if you look at hospital admissions in our area as well, again, you could see that we had high peaks here in January, high peaks here in April, and then higher peak in July, and then sort of downward trend. And you could see where it's kind of a flat line here on a downward turn. And if we're looking at other things that I just wanted to share with you, there's another, when we talk about the fall right now, we're not only talking about COVID, but we're also talking about other indicators. So we're looking at, for example, percent positivity, which is now moderate across the province, and actually this is the provincial, and then you could see kind of here that's moderate. There's really not much of a change. Influenza is low. And so this is what we're looking at. And moving forward, we're going to be looking at number of tests completed for influenza. And this, for example, was the cases of positivity of influenza, the yellow line over here. And just to show you that we had a bit of a uptick in May, which we don't usually see with influenza. So now we're just keeping an eye on it. Again, when we talk about surveillance about respiratory illnesses, we are talking about really the other viruses that are in the air and that are circulating in the air. There are airborne. And importantly, what we've been seeing, a lot of people have been reporting, kids at school sick, daycares, and so on. And we've seen a high percentage of positivity, not for COVID, but for other viruses. For example, the rhinovirus, which is a common cause of the common cold, and enterovirus that we've seen, which causes diarrhea and vomiting. We have a lot of outbreaks right now with just enteric outbreaks. Most of them are enterovirus. And there's also about 30 to 40% of the enteroviruses that we're seeing that are D68. And the D68 viruses really are essentially those that it's an enteric virus but causes colds. So again, that's what we're seeing a lot. So it's not just if somebody's sick, they are it's automatically COVID. No, right now, because we have these other things that are circulating. And by the way, it's the same precautions that we do, whether it's COVID or others. You stay at home, as we said, until you're better for 24 hours, and until you're better for 48 hours after you've had a gastro, and you mask for a total of 10 days. And that's important because we don't want the other illnesses to spread either as well. So, and then finally, I just want to go over locally, I want to look at our vaccinations. And we can see here again, we had a bit of an increase. I was looking at our in a weekly uptake. We administered about I would say another 4,500 vaccines in 1 week in our area, which was much better than we had before. We were barely at a couple of thousand or really high hundreds on a weekly basis. And so what we're seeing here, and again, the bivalent vaccine right now, which I recommend for everybody who's due for their next shot, whether it's 3 months after your last dose, your last, either your third or fourth dose, or if, for example, you need you're 3 months after your COVID infection, because you do need it. We know that if you have a COVID infection and you wait 3 months to get vaccinated, the vaccine protects you even more. And so it's quite important to get that. So what we're seeing here again, people need their booster. And so I can't overemphasize the importance of getting your booster. The bivalent is out there right now. The bivalent now has specific activity against Omicron, the Omicron B1, but also very good activity. I've seen the data against the B4 and B5 circulating variants, which we're seeing now in the community. They're mostly due to B5 right now. So it's important that people who are due for the next shot, and a lot of you are, because the vaccine wears off. And so what we want to do is we want to go into the winter months where we're really enclosed in with a high level of protection. And if we're protected against Omicron, which is the circulating strain, the vaccine will be much better protected against even getting it. As I've explained many times before, and I think it's worth repeating again, when we first had the vaccine available to us, it worked very well in both preventing infection, in other words, getting it, and if you got it, you were not sick. You were very mildly infected, and it prevented hospitalizations, deaths, and so on. What happened was, it's not that the vaccine wasn't effective against those strains, but it was really against the Alpha and Delta strains, the original strains. But last year, as you know, around November, the vaccine, the actual virus mutated, changed to a variant called Omicron, and the Omicron itself, because it changed a bit, it was not as sensitive to the vaccine as the previous version of Omicron, of the COVID-19. And so what we saw a very large spike of infections in January and April and so on, where millions of people got infected despite being vaccinated. But what we didn't see is we didn't see the rate of severe disease that we had seen previously before vaccine. So in other words, even the original version of the vaccine prevented severe disease and hospitalizations and death in people, even if they were infected by the Omicron variant. Now, with the new bivalents and moving forward, they're going to be tweaked to really reflect what's circulating. we will be able to not only continue to augment our protection and our ability to protect ourselves with the booster against severe disease and hospitalizations, but I know that the levels that we're obtaining in our blood after injection, the antibody levels are actually high enough to prevent transmission from one person to another. And that's the key that we want to do. We want to have higher rates of people that even if they're exposed to the virus, they don't get it, and the virus then will just fizzle out and just become a routine virus going in and out. So again, I can't underscore that importance of that. Again, I sent a message out last week just sort of summarizing all these things that people can do, still making sure that you stay home when you're sick, you wash your hands, wear masks in indoor spaces, crowded indoor spaces, particularly if you're uncomfortable or you're vulnerable yourself or with your vulnerable individuals. Wear a mask after you've been sick if you go out, after your isolation period. And basically, again, making sure that you're up to date. And I want to give a bit of a update to pediatric vaccines. Again, we're still about 5% of children less than 5 that have got their vaccine. I urge parents, again, to get the proper information, talk to your doctor, your healthcare provider. We know that the Omicron, although COVID does not cause severe infection in most kids, in younger kids, we've been seeing that because of the way it infects the lungs compared to the previous version, it infects the small airways, and children have a hard time breathing. And so we've seen with Omicron an increase in admissions to hospital in children less than 2 years of age. So again, it's not if you want to make sure, particularly if your child has underlying medical conditions, please get your child vaccinated or get the information before you make an informed decision. So once again, thank you very much for all your cooperation. I think, again, just to summarize, we're at moderate, stable levels in our community of COVID. We're seeing increases in other respiratory viruses, and the protections that we have suggested will protect us not only against COVID-19, but the other circulating viruses. The more we do those, the more we protect ourselves and others, the more we will protect our healthcare system from getting overwhelmed. And importantly, the more we'll protect the most vulnerable in our community. Thanks again. And I'll talk next week.